everyone, my name is Aashay Kothari and I work in Dr. Prasad's lab. I was mentored by Badri on this work, who is a PhD student in Dr. Prasad's lab. My poster is on a biosensor for the monitoring of IFN-γ from Eccrine sweat. Whenever a patient has any type of infection, their body naturally releases inflammatory molecules known as cytokines in the innate defense of their body. These molecules, also known as biomarkers, are used by physicians to help identify the progression of the inflammatory response during an infection. One of the key markers released during inflammation is the interferon gamma, otherwise known as IFN-γ. During an infection, patients are expected to have higher than normal levels of interferon gamma, and IFN-γ has also been shown to be elevated in the presence of tumors and in cancer patients. Normally, the IFN-γ level would be tested using a blood sample by trained personnel in a laboratory setting, which requires a significant amount of time to get the results. And on top of that, blood-based sampling is a single-point measurement and therefore is not suitable to continuously track the progression of infection for aiding in personalized medicine. In addition, blood sampling is also invasive. On the other hand, Eccrine sweat has shown great promise in detecting biomarkers such as IFN-γ non-invasively and continuously, and the eventual goal will be to ultimately integrate the IFN-γ sensing apparatus into a single wearable device. In order to reliably detect IFN-γ in sweat, a biosensor was developed that can detect both pro- and anti-inflammatory cytokines from passive sweat. Now, for the sensor to be highly sensitive and specific to IFN-γ, the respective IFN-γ antibodies need to be conjugated onto the electrode. This was achieved using cross-linker molecules, which function as the middleman, binding to both the antibodies and to the sensor. The metal semiconducting electrode was deposited onto a porous substrate where sweat would be absorbed and wicked through. Specific capture probe antibodies, now bound to the electrode, were then functionalized on the electrode to capture the target analyte, the IFN-γ antigens in sweat. The binding interaction between the analyte and the antibody results in a charge modulation at the electrode solution interface, which is captured as an impedance response using non-Faradaic impedance spectroscopy by applying a very small input voltage. A calibration curve was developed by varying concentrations of target analyte in sweat. A blank baseline was measured before adding the dose concentrations. It is observed that the change in impedance response increases with the increasing concentrations of IFN-γ, confirming that we can reliably detect a wide range of concentrations in sweat. A limit of detection of 1 picogram per milliliter was achieved with a wide dynamic range of 1 to 512 picogram per milliliter, which is in the relevant physiological range. In order to verify that the sensing response was only specific to IFN-γ, the sensor tests very high concentrations of similar biomolecules in sweat. It can be seen that very small changes in impedance occurred in the presence of these non-specific molecules, which indicates that the sensor demonstrated excellent specificity with no crosstalk to non-specific biomarkers, thus validating the robustness of the sensor. In summary, a sweat-based biosensor was developed to directly detect inflammatory biomarkers from passive Eccrine sweat. The sensor demonstrated sensitivity for detecting IFN-γ at an ultra-low concentration of 1 picogram per milliliter with a wide dynamic range of 1 to 512 picogram per milliliter. This was achieved by leveraging a novel sensing interface comprised of an antibody cross-linker complex. Such a biosensing system that can sample low volumes of sweat to accurately and continuously report levels of biomarkers non-invasively can be used for the real-time monitoring of health status. The developed sweat sensing device is envisioned as a wellness device to empower subjects for the real-time monitoring of their health status, and to also allow physicians to provide patient-centric therapeutic intervention in the event of inflammation or an infection. The focus of our future work is to test our sensor in both healthy and sick cohorts to demonstrate the feasibility of the developed sensor platform for use on human subjects. Thank you all so much for spending the time to listen to my presentation.